investment needed, the risks attached, the fear from regulatory and market change are all real obstacles in the quest for a vaccine. No private company, no government, no country alone can escape them. Partnerships are the only solution. Today, we're calling for action. Together, we can find the tools needed to address the crisis faster and better. Spain, my country, stands with you. My dear friends, you can count on our full support. Thank you very much. Muchas gracias.
Muchas gracias, Your Excellency. Now, a message from His Excellency, Mr. Dominic Raab, Secretary of State of Foreign Affairs and Commonwealth Affairs, United Kingdom of Great Britain and Northern Ireland. I would like to use this opportunity to appreciate my friend, Prime Minister Boris Johnson. He has been very, very keen on this initiative from the start and following up even while he was still unwell. And I would like to express my great respect and appreciation for his commitment to this initiative. And I hope he is now proud that it has reached this level and the whole world is behind this initiative. Thank you, Boris. And please, next message.
Let me start by thanking the World Health Organization and Dr. Tedros for convening this event. The Prime Minister asked me to convey that today's announcements have his full support. Now, we all know that COVID-19 is the biggest global threat the world has faced in a generation. For our part, the UK is striving to tackle the effects of the virus at home, whilst at the same time galvanising international action to drive the development of and fair access to a vaccine. The UK is one of the biggest donors to the international response. We have already pledged £744 million, and that includes £250 million of UK aid for the Coalition for Epidemic Preparedness Innovations to rapidly develop a coronavirus vaccine. We're supporting the University of Oxford and Imperial College London in their research to develop vaccines, contributing £42.5 million to support their work through clinical testing. And yesterday, the University of Oxford started phase 1 human safety trials. But as coronavirus has shown, in our interconnected world, diseases have no borders. And so it's only through coming together and collective solutions that we'll be able to defeat this virus. That's why the UK is proud to support the WHO's call to action. We welcome global health partners coming together to accelerate progress towards a vaccine. And we look forward to supporting the Global Coronavirus Response Summit on the 4th of May, which will drive forward our collective global effort to tackle coronavirus. It will ensure that desperately needed resources for research and development of new vaccines, therapeutics and diagnostics are made available so that we can overcome this disease. And we also look forward to working with Sir Andrew Whitty and Ngozi Okonjo-Iweala in their role as the new vaccine envoys. The UK will host the Global Vaccine Summit virtually on the 4th of June, where we need to fully fund Gavi and make sure Gavi's expertise and capacity are at the heart of our efforts to ensure equitable access for any vaccine. And just finally, I want to say the UK is proud to be standing side by side with our international partners in the fight against coronavirus. By working together, we can develop an affordable vaccine which is accessible to everyone who needs it as quickly as possible to end this pandemic once and for all.
Thank you, Your Excellency. Now we move to our key partners. They have been waiting online, listening to our leaders from all over the world. And I will start with Dr. Seth Berkley, Chief Executive Officer, Gavi, the Vaccine Alliance, who has been working very hard to make this launching a reality. My brother, you have the floor. Seth.
Thank you, Dr. Tedros, Excellencies, ladies and gentlemen. COVID-19 is truly a global problem and requires a global solution. To do so, we need the best science globally and to bring those solutions to all people. That is why I am so glad to be working with all of my other sister organizations to try to accelerate COVID-19 tools. As you know, Gavi, the Vaccine Alliance, currently helps vaccinate nearly half the world's children as part of its mission to save lives, reduce poverty, and protect the world against the threat of epidemics. We need other tools, but you will have heard it said that without a vaccine, we will never defeat this pandemic. This is likely true. And what this means is that we need to devise and deliver a vaccine program to get billions of doses out at a speed and scale never before contemplated, let alone achieved, the most rapid vaccine deployment in history. Gavi has a unique role to play in this global collaboration. With over 2 decades of experience at introducing nearly 500 new vaccines, we can help identify and prioritize the most suitable vaccines to make this momentous task possible and to scale up manufacturing at risk so that we have adequate supplies. Lastly, the infrastructure we have helped put in place in the countries we support, right down to the community level, will help us ensure not one person gets left behind. This is what Gavi was set up to do. We are already helping countries deliver vital testing and other equipment and working to maintain life-saving immunizations even as countries face up to the pandemic. The expertise and the structures to defeat COVID-19 are in place. Today, in this esteemed company, I'm proud to say we now have the commitment. We look forward to working with all of you. Thank you.
Thank you, Seth, and thank you, Gavi. Gavi and Global Fund actually have reprogrammed their funding from day one to fight COVID, and I would like to recognize that, and thank you so much for your leadership. Now I go to Peter Sands, the Executive Director, the Global Fund to fight AIDS, tuberculosis, and malaria. Peter, my friend, you have the floor.
Right. Thank you, Tedros. The Global Fund is committed to playing our part in this extraordinary and crucial partnership. Given our role, we're focusing primarily on the deployment of life-saving therapeutics and diagnostics, strengthening the vital systems of health to deliver the services, and also acting to mitigate the potentially disastrous knock-on impact on HIV, TB, malaria, diseases that kill 2.7 million people a year, and where we risk surrendering the tremendous gains we've made in recent years. In fighting COVID-19, in fact, we should learn the lessons from these earlier pandemics, from the fight we've had against HIV, TB, and malaria. First, we absolutely need new tools, and we need them fast. And we need to pursue vaccines, therapeutics, and diagnostics with equal vigor. A vaccine is the best answer, but it is not the only answer. It's worth reflecting that in the fight against HIV, TB, and malaria, despite huge efforts, we still don't have a vaccine against any of them. But with diagnostics, therapeutics, and prophylactics, we have demonstrated that we can achieve massive reductions in mortality, and many parts of the world have eliminated these diseases as threats to public health. Second, we must recognize that developing new tools is essential, but not enough. We must make sure the people who need them get them. The lessons from AIDS must be learned. Too many millions died before antiretroviral medicines were made widely accessible, in large part through the creation of the Global Fund. In the fight against COVID-19, we must leave no one behind. Third, access to drugs is also not enough. These have to be delivered within a system of care. This takes money, infrastructure, capacities. For example, less than a third of the cost of the fight against AIDS, TB, and malaria is the cost of the biomedical tools. And finally, we need everyone engaged in this fight. And above all, we need the communities that are most affected. Defeating COVID-19 and mitigating the impact on HIV, TB, and malaria will need not just the engagement of these communities, but their leadership. To defeat COVID-19, we must unite to fight. We must unite to fight this common threat to humanity. Thank you.
Thank you, Peter. And now we move to our other key partner, sister organization. I prefer to say what Seth said, Chief Executive Officer of the Coalition for Epidemic Preparedness and Innovation, CEPI, Dr. Richard Hatchett. Richard, you have the floor.
Thank you, Dr. Tedros. It's an honor to be here today to commit CEPI to work as part of the ACT Accelerator. The establishment of the ACT Accelerator is a watershed moment in the world coming together to develop a global exit strategy from the COVID-19 pandemic. The challenge we face in medical, humanitarian, and economic terms is unprecedented. We can meet it only by bringing together the combined strengths of governments, multilateral institutions, the private sector, and civil society. Everyone must have access to the tools and countermeasures, including vaccines, that we will develop through the ACT Accelerator. Science and policy must align in their commitment to equity and justice. We cannot meet the ongoing threat of COVID-19 one country at a time. COVID-19 anywhere is a threat everywhere. Today, there is hope. By bringing together the collective strengths, resources, and expertise of the institutions that will contribute to the ACT Accelerator, we can end this pandemic together. CEPI is proud to be part of this global collaborative effort.
Thank you, Richard. Thank you so much for your partnership. And now we move to UNITAID. The next speaker will be Executive Director of UNITAID, Mr. Felipe Donetan. Please, Felipe.
Thank you, Dr. Tedros, Your Excellencies, dear colleagues, ladies and gentlemen. These extraordinary times demand that the global health community stand in solidarity to find solutions to defeat and eliminate COVID-19. We also need to take care of people who were and still are under threat of other diseases. And just to pay attention, tomorrow is also the Malaria Day. But this global threat requires an unprecedented global response. The launch of the ACT Accelerator today is key to strengthen and accelerate the world coordinated response against COVID-19. We all know that we need a vaccine, but also, as soon as possible, we need test and treat approach that requires new treatments, better and faster diagnostic. This solution needs to work everywhere, including countries with weak health systems, and we need to ensure access to all those in need, including health and community workers. And we believe we, as part of the health community and with industry, we can make it. To succeed, we must rely on science and good R&D and ensure equitable and affordable access to this new tool. This is also the core activities of UNITAID's mandate. This requires close collaboration with all partners in the response. This is the commitment we are making today. UNITAID has already started and will actively collaborate alongside partners supporting an urgent and ambitious response to the COVID pandemic. It is the combat of our life, and we will do everything we can to succeed. Thanks for the head of states from the north and the south. Thanks for WHO to help all of us to make this happen for the people of the world. Thank you.
Thank you, Felipe. Thank you, UNITAID. Now we move to IFRC, the International Red Cross and Red Crescent Movement. and the Secretary General, Mr. Jagan Chapagain. Please, Jagan, you have the floor.
Excellencies, ladies and gentlemen, let me start by thanking Dr. Tedros for his leadership of WHO in this difficult time. The International Federation of Red Cross and Red Crescent Societies is fully committed to this global collaboration, the ACT Accelerator. As the largest volunteer-based humanitarian network, we join the call to assure equitable global access to new COVID-19 essential health technologies, starting from the most vulnerable communities in difficult and fragile contexts. Developing technologies, be it vaccines, drugs, or diagnostics, is a very important first step. Ensuring fair allocation and timely delivery to all in need is the greatest challenge. The time to prioritize equity is now. This means putting the most disadvantaged communities at the center of our collective response to this pandemic. We in IFRC pay tribute to 14 million Red Cross Red Crescent volunteers and all other volunteers for their heroic work at the community level in more than 192 countries. And we offer this network in support of this global effort to ensure that no one is left behind in this humanitarian crisis. The power of our humanity is and will be measured by how we collectively protect the weakest among us. Thank you.
Thank you, Jagan. Thank you, IFRC. Now I'd like to invite my brother, Sir Dr. Jeremy Farah, Director, Wellcome Trust. Jeremy, you have the floor.
Dr. Tedros, Your Excellencies and colleagues from around the world, thank you very much for bringing us together. Amidst the horror of this pandemic, this partnership does offer us our greatest hope, and also by bringing everybody together, the greatest chance to deliver. The whole world is affected, and the whole world must come together to find an equitable way through this. We must leave no one behind, as we've heard repeatedly today. Physical distancing, testing, isolation, and the best clinical care are absolutely crucial now. But this is now a human endemic infection. It will not disappear. This is not SARS. The only true exit strategy is through science and the manufacturing of that science and the equitable distribution to the world to make sure everybody receives it independent of their ability to pay. And we do need all. We need diagnostics, we need treatment, and we need vaccines, and we have to have the capacity to deliver them, not just make them. This is what this unprecedented partnership can, and this is what this unprecedented partnership will deliver. Thank you to the inspirational comments and support from all the world leaders, to the WHO, to the global agencies, to citizens and to philanthropy, and also to the private sector who have come together under the coordination of the WHO in an unprecedented way to address an unprecedented crisis. A chance to end this pandemic through multilateralism, and out of this pandemic and out of this crisis, the chance to actually forge a better world which is more equitable and which commits to public health. That is the prize of our time. Yes, for COVID, but actually beyond COVID to the whole of public health. And it's a question of social justice and equity. It's a question of the sort of world that we want to live in. Thank you, Dr. Tedros. Thank you to yourself, the great leadership through this, but also thank you to your great team alongside you who have made this happen, and it has not been always easy. And I pay tribute to all the healthcare workers all over the world who are putting their lives at risk so that all of us can be that little bit safer. The hard work starts now, and nobody should be under any illusion this is going to be incredibly hard work. But together we can, together we will, and together we must. Dr. Tedros, thank you very much for your leadership.
Thank you, Jeremy. I fully agree, together. And I also would like to borrow your word, a better world out of this difficult situation. Thank you so much for reminding us that. You have heard from our political leaders, our agency leaders, And now the next group will be the business leaders. We don't believe that this initiative will succeed without the private sector. So I have colleagues who will be speaking, representing the private sector. The private sector is central to the success of this initiative. And I would like to invite Mr. Thomas Coney, Ambassador Thomas Coney, Director General, International Federation of Pharmaceutical Manufacturers, IFPMA. You have the floor, Thomas.
Now I'm unmuted. Thank you, Dr. Tedros. The biopharmaceutical industry is acutely aware of the enormous responsibility we have to patients and society to engage in unprecedented levels of collaboration to find a solution to COVID-19. We stand ready to bring to this partnership our unique knowledge and expertise in the discovery and development of medicines and vaccines, as well as our experience in building manufacturing capacity and distribution networks. Today, scientists in the public and private sector hold the keys to our common goal, the swift end of the COVID-19 pandemic. We are proud to be part of this landmark global partnership and are fully committed to its goal to accelerate development, production, and equitable global access to safe, effective, and affordable COVID-19 therapeutics and vaccines. In the fight against COVID-19, we must ensure that no one is left behind. We will only succeed in this journey together. Thank you, Dr. Tedros.
Thank you so much, Thomas. And now we move to another colleague, Ms. Hanan Subol, Chair, the International Generic and Biosimilar Medicines Association. Madam, you have the floor.
Tedros, Your Excellency, alongside the need for the novel treatments to combat COVID-19, there is a tremendous need for existing medicines to treat infected patients. The global generic and biosimilar medicines industry, IGBA, is living up to its vision to improve access to those cost-effective, quality medicines worldwide. We call on the global community and political leaders to support this landmark collaboration to ensure that every single patient around the globe is treated. Thank you.
Thank you so much indeed. And now the next speaker will be the President of the Developing Countries Vaccine Manufacturers Network, Mr. Sai Prasad. I think if you can unmute probably.
Thank you. Yeah, thank you, Dr. Tedros. We, the Developing Country Vaccine Manufacturers Network, hereby express our steadfast commitment to support COVAX's objectives. Our network of manufacturers supply more than 3 billion doses of vaccines in 170 countries every year. Our commitment to COVID access is expressed in 3 distinct ways. First, many companies in our network are developing vaccines against COVID-19. Second, our network of manufacturers are based across countries around the world with manufacturing facilities, capacities, and expertise, which are ready to be deployed when vaccines are available for COVID-19. Third, and most importantly, we continue to manufacture and supply other life-saving vaccines, which are critical for global public health. Dr. Tedros, the co-hosts, Your Excellencies, we appreciate the opportunity to serve the global community with this call to action. And we leave you with the statement, leave no one behind. Thank you.
Leave no one behind. Thank you, Dr. Prasad. Namaste. Thank you so much.
Namaste.
Thank you. So we have listened to our political leaders, agency leaders, business leaders, and now I will move into our other speakers. Two of them are special envoys, Dr. Ngozi Okonjo-Iweala, and also Sir Andrew Whitty. So I will start with Ngozi. My sister, you have the floor, and congratulations, and thank you also for accepting our challenge to be a special envoy for this very, very important initiative, ACT and Accelerate. Thank you. Ngozi.
Can you hear me?
Yes, we can hear you, please.
Okay, thank you so much, Dr. Tedros. Thank you for your leadership under these difficult times. Thank you, Your Excellencies, for coming together on this global endeavor. I won't say much except to say it's an honor to accept this task, to serve the global common good, and to act as a bridge to the developing world, especially to my continent, Africa. Equity, access, and affordability are the key tenets of our efforts and should remain the key tenets. We must all come together and work to achieve all this. Thank you so much.
Thank you, Ngozi. Thank you so much indeed. And Ngozi is also selected as special envoy by His Excellency President Cyril Ramaphosa to lead the COVID response event in Africa, and she will act as a bridge between Africa and this initiative, and that will be a very, very important role. So having said that, now I'll move to Sir Andrew Whitty, former CEO of GSK, and now our special envoy. You have the floor, and thank you so much for accepting to really lead this effort. Thank you.
Dr. Tedros, thank you very much for this opportunity. I'm humbled to have been asked to undertake this role to support this unprecedented coalition. And all I want to say simply today is I'm absolutely committed to working with all of the partners to build on all of the work that's been done already, to avoid duplicating work, to help catalyze the fantastic efforts that have already been undertaken, with a mission to achieve great equitable access to the various tools that we know we need to deal with this pandemic. Please count on me for open-minded, energetic support and engagement. And I simply ask in return for your support and collaboration in helping us to work forward to bring this to an end as quickly as possible. Thank you.
Thank you so much, Sir Andrew Whitty. So we're coming to the end of our launch. Thank you so much to all our political leaders who have given your support and for your leadership. And thank you also to our agency leaders, to our business leaders, and also to our envoys. This is everybody's business, as you said, and we will do everything to make this initiative a success as partners. And I would also like to end this launch by reminding you that May 4th will be the pledging event that will be hosted by European Commission, and you have already heard from President Ursula von der Leyen and other participants of this launch, and we hope to see you all then on May 14 to make the pledging event a success. So thank you so much again from our side, and united, we can defeat this virus, and we have to fight it in unison. Thank you so much again. May 4. Again, sorry, I think I said May 14. The pledging event is May 4. And let's join the European Commission and President Ursula von der Leyen to make this pledging event a success. May 4 is the date. Thank you.
Thank you very much, Dr. Tedros, and thanks to all our guests. We will have a transcript available from this event in hopefully next couple of hours, because there were little audio issues with some of the speakers, so hopefully that will be helpful. We will be also sending you documents regarding this event, as well as other news from WHO regions and country offices. Next press conference on COVID-19 will be on Monday. Have a great weekend, everyone. Thank you.